When is the right time to start hormone replacement therapy, or am I too young? In the United States, the average age of menopause is 52 years old, but we can start experiencing symptoms of perimenopause as early as age 35. I personally started experiencing those symptoms around age 38 and started HRT at 39. One of the first hormones that starts to fluctuate in perimenopause is your progesterone. Progesterone is our calming hormone. It keeps us asleep hormone. I describe it often as nature's Xanax. Without progesterone, estrogen can become unopposed in our body, making us estrogen dominant and causing symptoms like irritability, bloating, breast tenderness, and even irregular periods. So simply replacing progesterone can be a huge help for women in early perimenopause. Also, testosterone starts to decline. Our testosterone levels are not even close to where they were in our 20s once we reach 40. Lack of testosterone can cause symptoms like low libido, vaginal dryness, painful sex, or just low motivation overall. It can even cause a decrease in muscle mass or inability to gain muscle when you're working out. Testosterone replacement is definitely an option for women in their 30s, late 30s, and early 40s, and it makes a huge difference. I know for myself. So, if you're interested in talking and learning more about bioidentical hormone replacement, please don't hesitate to reach out. You can find more information via my website, simonemedical.com, or you can email me, info@simonemedical.com. Thanks for listening.